Good evening, everyone, and welcome to our Digital Health Essentials for General Practice webinar. This evening we will learn what the ePIP is and how do you make sure your practice is meeting requirements. Have an introduction into using My Health Record effectively in your general practice and see a demonstration of how to use EReferrals with HealthLink and hear about who you can send EReferrals to in Western Victoria. My name is Helene. I'm the Workforce Development Coordinator here at the PHN, and I'll facilitate this evening alongside Jade, who is also in the Workforce Development team. I'd like to begin by acknowledging the traditional owners and custodians of our unceded lands and waterways. We recognise their diversity, resilience, and the ongoing place that First Peoples hold in our communities. We pay our respects to elders, both past and present, and commit to working together in the spirit of mutual understanding, respect, and reconciliation. We support self-determination for First Nations peoples and organisations. Just a little bit of housekeeping. Please take a moment to view our upcoming events that are currently on the screen. A link will be in the chat for those, so you can have a look at the full list and register via that. You can also access most of our previous webinar recordings free on our PHN Learn YouTube channel, and you'll see the link in the chat as well. Now, our biggest PHN education event of the year is our annual Primary Care Conference, and this is take place 9th and 10th of October at the Good Shed in Ballarat. There's some fantastic keynote speakers locked in and education sessions planned. Registrations will open in early July, and you can we will release more information about our speakers and planned sessions then. Our Learn and Network newsletter is the best way to stay up to date with our latest education opportunities and upcoming events. If you haven't received an edition yet, please subscribe via the link in the chat or scan the QR code now on the screen. Editions are released on the first Tuesday of each month. Just a reminder about our Health Pathways, a free online resource with localised clinical and referral information for health practitioners. Please ensure your full name is displayed correctly for your certificate of attendance. Updated or added in the chat if needed. This session is also being recorded, so please stay on mute during presentation and use the chat for questions. We'll cover these in the question and answer at the end, where you're also welcome to ask verbally. Your feedback is important, so if you can take the time to complete the event survey after the webinar, there will be a link in the chat box to complete this. Let's get on to our presentation for this evening, and I'd like to introduce our presenter, Sarah Crowe, Digital Health Manager at Western Victoria Primary Health Network. Over to you, Sarah.
Thanks so much, Helene. And hi, everyone. Thank you for having me. As mentioned, I'm the Digital Health Manager at Westvic PHN. And you may have met me before or someone from my team, the digital health team. We often come out to practices and will help you with all different digital health topics. But of course, today we are talking about ePIP, My Health Record, and the bonus topic, EReferrals, which I'm sure everyone's excited to hear about. So I'm just going to share my screen and get us crack-a-lackin' because I've got lots of exciting content to get through tonight. Thanks for taking the time to be here. So as you may well be aware, we've got some learning outcomes to cover tonight. I want you, by the end of this session, to be able to give an overview of how my health record works and how best to use it every day in your practice. I want you to be able to identify what the ePIP is, what is this ePIP thing, and how to meet the minimum requirements. And I want you to know what EReferrals are and learn a little bit about who's accepting EReferrals in Western Victoria. So I'm going to kick off today with a little bit about my health record. Now, apologies if you're an expert. I am going to make sure that I cover enough content that everybody knows the basics as well. So to begin with, I'm going to talk about what my health record is. Now, there might be some people in the room that remember that maybe still have patients or have had patients in the past that have a big folder and they put all their health information into this folder and they have to carry it around, and it's got old handwritten notes in it, and it's got print out results that were printed 10 years ago that you can't see, and lots of added information. My Health Record replaces the need to do that. It's a digital record online in a secure system that follows the patient wherever they go across Australia. So it's not intended to replace the medical record sitting in your practices, but it is an online summary of a person's healthcare. It's personally controlled, so you as patients and me as a patient, I can go in and control my health record and access it. It's part of a national system, so all healthcare organisations can get access to it. It's accessible at all times, and of course, it's protected by legislation and high security. And now, interesting to know, in case anyone doesn't know, in Australia, we have an opt-out model for My Health Record now, and that means everybody has a My Health Record unless you have opted out in the past. Now, I have found that because of lots of fear campaigns that happened in the media about 10 years ago, a lot of people have opted out and not realised it. So if you've got someone who goes, I want one, but I must have accidentally opted out at some point, you can just log into your MyGov account and you can reset up the My Health Record. So what's in this My Health Record? There's lots of information that healthcare providers can upload. I'm going to talk a little bit later about this thing called a shared health summary, which is basically a snapshot point in time of important details of somebody's health. Discharge summaries from hospitals can be uploaded. There's these things called event summaries, which any healthcare organisation can upload. It might be a physio or a specialist or whatnot. All the prescription and dispense records for medications are in My Health Record. And I will touch on it a bit later, but diagnostic imaging reports and pathology is also now across the board going to be available in My Health Record for everybody. A lot of it already is, you might have noticed. So that's really exciting. The consumer themselves can add in extra information. They can put personal health notes. They can upload their advanced care planning document. They can put their emergency contacts and all that kind of information. It also pulls information from Medicare. So you can have a look at what they've been billed in the past. I can go and count how many times I saw the physio in the last year by going and checking that Medicare information in My Health Record. And there's a few My Medicare registrations and things like that, of course, are sitting in there as well. So that's about what's in this My Health Record. So why is it good for patient care? There's a few reasons it's really good for patient care. One, it can result in less duplication. So if you can access the pathology result that was ordered by somebody else, you don't have to repeat that test. You can see the results and it could come in really handy for your clinical decision making, which is the next point, better informed decisions. So if you've got access to more information about this patient, of course, it makes your job easier and you can make more informed decisions, as can the rest of the healthcare team looking after your patient, if they can access the information that you upload. And this one I'm really excited about. It supports active management of health. So as a patient, by being able to access my own information, I am much more engaged in my own healthcare journey. And I'm going to tell you a little story to prove that that's not just a line, it is true. Most of the people in my family are either pre-diabetic or diabetic. And of course, as digital health manager, I've made them all download the My Health Record app, which is called 1-800-Medicare now. So we've all got that app, and because pathology is going into My Health Record, we're all seeing our results come through on My Health Record. And as a family, we've got a bit of a competition happening about our HbA1c management. And of course, I was very happy to say that I won the last competition because mine was the best handled. And of course, it leads to these conversations. What did you do differently that got you that HbA1c management? And we're patting each other on the back about making positive changes in our health. That wouldn't be happening if we didn't have access to that information on our phones in our hands. So it absolutely does lead to engaged patients in their own healthcare. And of course, having that information for everyone improves safety. If you can see what else that patient, where else that patient has been and what information is important, it's going to be safer for everyone, and we're going to achieve better health outcomes across the board. So before everyone says, well, I don't know, because nobody's using it, I've got some recent data here. This is the February statistics about how many different of our different organisations across the country are registered for My Health Record and have used My Health Record. And pats on the back to general practice, because of course you are the ones who started using it all, even when there was nothing in it. But we're seeing an increase in aged care and certainly specialists. And we're going to be working with allied health professionals as well to start connecting with My Health Record and using it. So that's how your healthcare providers are using it. But I also thought it'd be good to point out that your patients are using it. So these are the statistics you can see across the country of how many people, how many views are happening by patients themselves. And you'll see in February, just February this year, there were almost 22 million views of people's own My Health Record, which is huge. So now to get to the nitty gritty, and I promise I'm not going to get into the boring stuff for too long, but I think it's important to understand what healthcare identifiers are. So healthcare identifiers is a national system that supports information sharing by accurately identifying the healthcare recipient, so the patient, the healthcare provider, and the organisation at which that happened. So each of those different people have a healthcare identifier number, and that's how we authenticate that it is the right person receiving the care, delivering the care, and uploading the information and where that was done. So in your clinical software, you need to have your HPIO, or I call it HIPIO. The HIPIO is your organisation's healthcare identifier number. That will be sitting in your software. Your practice manager will usually pop that in. You also, each provider, so each GP and practice nurse will need to put in their HPII or their HIPII, their healthcare provider identifier number, to prove that they are the provider that they say they are. And then patients themselves all have their own number as well. And when you open up, let's say you're in best practice and you open up the patient demographics page, you'll see that number on the top right-hand side, and that gets verified automatically all the time, each day in your system for you, usually by receptionists, or it might be on auto verify. So they're the three numbers that you need to make sure. Usually if a My Health Record issue arises at a clinic, I go and check those three things are there, because often it's the fact that one of those things are missing that it's not working. And if you're here today and you're not sure if you have one, or you've never used My Health Record and you want to go and find out what your healthcare identifier number is, everyone who is APRA registered has one. You can log into your APRA account, it will be there. And I've also listed some phone numbers there that you can call to get that number, to make sure you give it to your practice manager or to your organisation to have it uploaded into your software. And these slides will be shared after this session, so you can go back and find any of those phone numbers if that's something that you need to do. So who can view My Health Record? Anyone, any healthcare provider can access a My Health Record as long as it's for the purpose of providing healthcare and it's subject to whatever controls the patient may have put on. So there used to be a system where you had to get consent for every single time you accessed it. That is no longer. If you are registered for the My Health Record in your organisation and you are trained and you are accessing it because it's going to inform how you deliver healthcare, you can access and view what's in there. Absolutely. And in terms of uploading, it's pretty similar. If it's for the purpose of providing care, or you've provided care or have new information about that patient, you're allowed to upload, as long as you have a HIPII number, that healthcare identifier number as a provider, and your software has been configured to have access. Which, if you've got issues with that, I'm not going to go into big detail about that today, but I can certainly help you out. So don't hesitate to get in contact with me and my team. So you're going to hear me talk about this shared health summary and everyone talk about these shared health summaries, right? It's a summary of an individual's health status at a point in time, and it includes medical conditions, medicines, allergies and reactions, and immunisation. So it's got those 4 key pieces of information, and every time any of those things change, you can do a new upload of a shared health summary, which is super easy to do. As a informed patient, I'm constantly reminding my GP, although she's pretty good, to do a shared health summary upload when something changes or something is new. And for those who have used this before, I sometimes get comments around the medical history part you see there, which has all the listed diagnosis that you've got on the medical file, whether it's best practice, medical director, or ZMed. That's a list of all the active diagnoses. If that list is ridiculously long and you're seeing things that you don't think should be included or they're not current, that actually means they need to be marked as inactive in your medical software. So I actually sat down, the last time I had a care plan, me and my GP it took all of 3 minutes, I think. We spent about 3 minutes going through all the diagnoses that were still sitting there as active in best practice and deciding what we were going to mark as inactive. You know, the physio doesn't need to know, the specialist doesn't need to know that I had my tonsils out in 2001, you know? So we removed that as an inactive diagnosis. So when it comes to actually putting all this into practice, how do I implement my health record effectively in my practice? I like to simplify it down into 3 steps. 1, you must have a policy. As a practice, you must have a policy in place. I'm going to give you some guidance around that and some resources around that. There is a template available, but you must have a policy in place that gets reviewed annually. Much like most of your policies, a lot of your policies need to be reviewed at certain points to get through your accreditation. This has to be in there and it must be reviewed and kept up to date. Now, in that policy, it's going to talk about staff training. So your staff need to access appropriate training and you need to record that. Usually you have a training register for accreditation anyway. And in terms of accessing that training, I'm going to share some information about some e-learning modules that I promise are quick and easy and very detailed. You can pick what software you use and it provides you with that training. That's from the Australian Digital Health Agency. So there's those e-learning modules that you can dedicate and you can print off a certificate at the end and have that stored in your training register at the practice. So you need to do your staff training. And then 3, you actually need to upload and start using it. 3 easy steps: policy, train your staff or access the training yourself, and then start using it and uploading. My health record will only ever be as good as how it's used, right? If we're not putting things in, it's not going to be as useful, but we're seeing that problem go away. Most people are using it, and there's certainly a huge increase in the content that's available in there. So I am going to show you quickly this Practice Connect, practiceconnect.com.au. If you haven't been here before, I highly recommend it, particularly for practice managers, but also for anyone else looking for specific resources and information that might be useful. So I'll share my screen on this one. Share, share, share. All right, there we go. Hopefully everyone can see that okay. So this is the Practice Connect website. It's where we put a whole lot of resources for everybody. My Medicare information, guidance, QI activities. But if I go down to programs and national schemes, which we know my health record is, I'm going to go in there and I'm going to go look at the My Health Record. Hot off the press, we've just updated this page today because it follows my 3 easy steps. So it's got our email address to reach out. We can also come and, if you would prefer face-to-face training, we can come out to your clinic and provide a group of you or one of you some My Health Record training. But I've got those 3 easy steps sitting here and all of the resources that you might need to click through. So in terms of that policy, I've got a link there that takes you to guidance under template. It's not ours, it's the OAIC, so it's nationally approved. You can go and complete the policy there if you think you don't already have one or you want to do a new one. And then I've also got the links there to the e-learning modules I mentioned, or the fact that you can reach out to us for face-to-face training sessions. So that's all there as well. Now, the next question is going to be, but how, Sarah? How do I actually use it? Well, have I got something to show you? Depending on which of the softwares you use, I've linked in all these very short, I think the longest one is just over a minute, these very short little videos of how to actually upload. So including how to upload a shared health summary. Now, there's not going to be sound because I haven't shared sound, but we're not going to watch the whole thing. I just want to show you how easy this is and how simple it is. And if I skip through, it literally opens up a best practice file. And it's going to show you exactly where to click to do it. So we've got all those videos there for you to go and have a look. How do I actually do it? And then we've also got some information there about better and faster access, which I'll talk about shortly anyway. So there's lots of resources there. We are here to help you. If you don't know how to use it, we can show you how, and we can show you specifically in your software how to do it. Just going to pull back up to my slides. Here we go. Alrighty, so that's the Practice Connect website. It's got all those resources there for you. So some people might have caught, what is this better and faster access thing you say, Sarah? Well, I will tell you. There's been some exciting changes happening in My Health Record that I think are really positive, both for you and healthcare providers, but also for patients. So better access is about a new law, new legislation that says that pathology and diagnostic imaging reports must be uploaded by default unless otherwise stipulated by either the provider or the patient. So that can be yourself or the patient. This is great because what we've seen in the past is people, because it might be hard to set up, big companies, big organizations, big providers might have decided to stop uploading or not uploading the information that you need. Now they have to, by law, unless otherwise stipulated by the patient or the provider, which you can do on an individual basis. You can do, like the patient can opt out permanently, but also you can tick that box on a request saying do not upload to My Health Record and the patient can decide not to. This is a great change. This means that when, as I've mentioned earlier, when somebody else has ordered the test and you would like to see the results, they're going to be in My Health Record so you can access them. No more spending hours on the phone chasing it down. No more worrying because the patient had a test but they don't remember what it was or where it was. You can go and find that information directly from your software. You can access My Health Record and go and view that information. There's short videos on that Practice Connect website I just showed you on how to do that. And you can even download it and pop it into your best practice or medical director file. So that's better access. It's the share by default rule, and they're starting with diagnostic imaging and pathology, a great change for everybody. Faster access is much more aimed at patients. And what this means is that previously there's been a 7-day delay on patients seeing their own results. That has now been removed for some results. So for pathology, there is a specific list, and I don't think I've shared it here, but I'll share it after the session. There is a list of what results will be immediately available to the patient. It's usually the low risk ones. So they will be available immediately for the patient to view, and any of the higher risk ones will be available with a 5-day delay. Same thing goes for X-ray results and diagnostic imaging reports. They don't get the image of it, but they get the report. If it's of limbs, they get it immediately. If it's anything that's not your arms or your legs, there will be a 5-day delay on the patient seeing that result. So they will be able to see it, but after 5 days, that's to give providers like you a chance to actually follow up any urgent results. It can be a little bit confronting, but there's lots of things in place. For example, if you're accredited, you might know about the buddy system, which means that if you're not in, somebody else checks your results for urgent information or urgent results that they're giving. That's the kinds of things that cover it. But I think it's a positive step. For example, the HbA1c competition that happens in my family wouldn't be happening without us accessing that. So I think it's a good change. How do patients access this information? I mentioned we were doing it on our phones. If you've got your phone on you right now, I do encourage you to pull it out, scan that QR code if you haven't already got the app, and download it for yourself. Go and have a look at what it looks like. It's a really great app. It used to be called the My Health app, and now it's called the 1-800 Medicare app. It's got lots of great features. I can see my current diagnoses. I can see my pathology and radiology results. I can see my immunization history and check that. I can have a look at my Medicare data, my prescription data. But the little tip I really like in it is that you can store eScript tokens in there. So when you get that text from your GP or the pharmacist with an e token in it to get an eScript, often it was driving me crazy when I had to go back 3 months later and get it filled again, and I'm searching through my phone to try and find that text. You can actually store all of those in your 1-800 Medicare app, which does two things. It makes it very easy to find and for me to know what active scripts I've got, but it also kind of works as a script list. So I can easily go there and look up what medications I'm currently taking. So that's a really great feature. Highly recommend it to simplify e-prescribing as well for people. All right, I'm gonna give my health record a little rest. Or no, I'm not. I'm going to use it as a transition into this thing that you might have seen called ePIP. So some people might be aware that we have a practice incentive program in Australia for general practices. There are a number of different incentive payments programs available, and it's all about improving quality of care or building capacity or supporting rural medicine. So you'll see on the screen there's 3 different streams of practice incentive payments. Most practices are registered for a lot of these. So obviously these Indigenous health incentive is all about providing quality care to people who are Aboriginal or Torres Strait Islander. There's the PIP-QI. I'm not going to go into detail about that today, but that's about doing continuous quality improvement as a practice. So you get incentivized as a practice for that. There's an after-hours incentive if you're going to provide after-hours care. Obviously, there's the e-health incentive payment, and it's highlighted because that's what I'd like to talk to you all about today. I won't go through the rest. I'm sure you've seen them before. And if you haven't, there is lots of information online, or you can reach out to the digital health team or your primary care engagement officer, if you know who that is at Westvic PHN. But today we're going to hone in on the e-health incentive. So to be part of this whole, what we call PIP program, practices must be accredited or registered to be accredited. They must be a general practice providing general practice services. There's a few rules around maintaining public liability insurance and having indemnity insurance, and obviously making sure that you're registered for these PIP programs through what's called your PROTA account, which I think most people would have a PROTA account that are in this room. As I said, though, today we're focusing on the eHealth PIP and how you can make sure that you're meeting the requirements for that and why. Why is it important? So the eHealth PIP, there's a number of different eligibility criteria. And if we've got practice managers in the room or people that manage the organisation's PROTA account, again, you'll get these slides and you can see there's a number of different eligibility requirements. You have to be set up for secure messaging. You have to have a NASH certificate through your PROTA account. You have to have your healthcare identifiers recorded in your clinical software. You have to be working towards using coded diagnosis. I'm not going to go into that about that today, but I'm pretty passionate about it. So welcome to hit me up for a conversation offline. And you have to be using eScripts. So if the barcodes, not eScripts, the prescription exchange service. So if you've got barcodes printing out on your scripts, then you're covered. That's the eligibility to participate in eHealth. But more importantly, what do I have to do? What do we have to do to maintain this practice incentive payment so that our practice can continue providing quality resources and stay open and be sustainable? Well, there's two things you have to do. One, you have to have that My Health Record policy in place and do your staff training. And two, you have to upload shared health summaries for a minimum of 0.5% of your practice's average patient size. So you'll see there's this thing called SWIPI, Standard Whole Patient Equivalent. What that is, I'm not going to go into detail, but it's quite a complicated calculation that is done at the Commonwealth at Services Australia. They look at Medicare data, they look at how many practitioners you've got and how many services are provided, and they figure out who are your active patient population. Who are the patients that are coming frequently to your repeatedly to your clinic, and that's how they count how many patients you have. So you need to do, it's a very small target, 0.5% of that number. So your SWIPI might be 1,000 patients, or often it's much larger if you're at a bigger practice, and you only have to upload 0.5% of those per quarter. Some of you might have had practice managers running into you at the end of a quarter and going, hey, can you do 10 today? I'm not going to lie. When I was practice managing myself, I was that person. I would run into a particular doctor's office and try and convince them to do 10 uploads that day to make sure we meet the requirements. What I'm hoping after today is you see the benefit and it doesn't become this mad race to do that small number. It should actually be embedded in how you're providing healthcare. So, what are my ideas to try and drive uploads? I've got a few. One is if you have a health assessment, whether it's 75 pluses or 45 to 49-year-olds or your Indigenous health assessments, add it to the template. At the end of the template, have a tick box that says, have you done a shared health summary upload? And that can trigger either the nurse or the GP to remember to check and do that upload. It only takes a few seconds, but it can make a big difference. Same thing for your care plan template. You could add a little box at the end. Have you done a shared health summary upload to remind people to do that upload? Every time a vaccine is given, you can do a new shared health summary upload. So it could be part of your workflows when you administer a vaccine. You take the 10 seconds to go and do that. Medication reviews would be another one where you could embed uploading into that service. As I mentioned before, when I sat down in my care plan with my doctor and went through the diagnoses that were sitting on my file, it's good for her. It's good for her, the referral letters that she writes for me, making sure that that list of diagnoses is active and current. And if it's not, right click and marking it inactive so it goes into the past history rather than sitting on my file as a current diagnosis. And like I just said, referrals to other services. It's great to make sure when you do a referral to another service, it's great to make sure you do a shared health summary as well, because then that practice can, or that provider will have up-to-date information and they may go and check my health record to check what medications, what allergies they might have. So it's a great way to improve referring patients and making sure that they have all the information that they need. Now, I'm just going to let that sink in for a moment, give everyone one moment while I swap over, because I'm going to throw in my bonus topic now, which is e-referrals. All right, e-referrals in Western Victoria. Who and how? So e-referrals, as you might guess, is a electronic way of sending referrals to another healthcare organisation for a patient. Why are they good? Why should you use them where you can? Well, it's fast message delivery and it reduces handling and mistakes. You can track the status of the referral often directly from your own software. It reduces referral rejections because if you're using an e-referral template or a system, they're actually going to make sure that all the information they need is a required field. So it'll make sure that your referral is quality and providing the information that they need. It eliminates scanning. Yay, we all love a bit of that. It can be integrated into normal workflows for clinicians, and I'm hoping I can get my best practice software open today and give you a little look at what that looks like. It can reduce costs to provider organisations. It absolutely protects patient privacy because it's a secure method of sending private patient information. It reduces risk. It makes sure that it actually gets where it needs to go. And it reduces interpretation mistakes because it's electronic, it's not handwritten, and it hasn't got extra information or confusing information on it. So that's what e-referrals are. I'm just showing you there's lots of different e-referral softwares out there. So you might have heard of HealthLink. Most of you probably have it. You might have heard of ConsultMed, Medical Objects. In the past, we had Argus, and what was the other one? ReferralNet. There's lots of different softwares available, but I'm actually going to focus on HealthLink today for a few reasons, mainly because I'm watching it get picked up all over Western Victoria. So e-referrals at times can be frustrating because you don't get to choose necessarily what you're going to send something on. You have to send it in the system that whoever you're referring to, whether it's the hospital or whoever, you have to send it through the system they're using, right? So it's a really positive move to see lots of our big health services are actually starting to use HealthLink, which means you guys just need to know how to use HealthLink if you're going to send these e-referrals and use this system. So who is using HealthLink in Western Victoria at the moment? Well, last I checked, it was approximately 80% of general practices already have HealthLink installed on your system. You might not know you have it, but you have it. And that number is growing every day. Barwon Health, if you're in that region, is currently transitioning to sending you information via HealthLink. So that'll come directly into your inbox in best practice or whatever you're using. So they're doing outbound communication. And Grampians Health is now accepting information from you via HealthLink. You can send information via HealthLink directly from the file, but they've also just released, using HealthLink Smart Forms, their e-referral for Ballarat Health Services. And I'm going to show you a big list of who you can refer to using e-referral on that. There are actually a bunch of specialists using HealthLink as well. I've written there, Australian Hearing Australia. I think Hearing Australia, it should be, is accepting referrals via HealthLink. You might know HealthLink because My Aged Care referrals are all done through there now. And the Medicare mental health service, that free mental health service that exists, that is also accepting e-referrals through HealthLink. And when you get the slides, I've put a link at the bottom of the screen that actually shows you where you can access a list of all of those who's accepting HealthLink e-referrals, which is called Smart Forms, what we're talking about. HealthLink call it Smart Forms. So with this exciting news about Grampians Health now using e-referral, I've put on the screen there a list of all the different services that are accepting via e-referral, but there's also a link to go and have a look at that information online, so you can go back and have a look another time. And now I'm going to stop sharing for a moment because I'm actually going to open up my best practice screen. Hopefully it's still open, and show you exactly what HealthLink Smart Forms looks like on my test server. So just bear in mind what I'm about to show you is a test version of best practice. All the patient names and information in there are completely fictitious. They're not real. They're all part of a test database. So this is not real data. You can see I'm looking at Dr. Eva Cure, a fake doctor. And you might be seeing Mr. Alan Abbott. So usually when you would write a referral, you would probably go to correspondence out over here, or you might just go and click the letter writer and go and fill out a template that's sitting within your own clinic. What you could do instead is actually go here to HealthLink forms. It's sitting there. Alternatively, you may have set it up so that you have, or your practice manager might have set it up so you actually have a HealthLink button up the top here, HL, and I'm going to click that. It's actually going to load the smart forms or e-referral system directly from the file. You don't have to go anywhere else. Just going to make it a bit bigger so you can have a look what's in here. So you'll see some names here that they're all accepting e-referrals. So you can go and click on them and refer directly. And as mentioned, Grampians Health have now come to the party, which is very exciting. And there has been a lot of work from their end to get this system set up, and from HealthLink as well. But you can see a list here of all the services that you can now use e-referral to send to. And for example, the cancer services. So this is all for Ballarat Health Services. So I click what place I want to send to. It comes up with locations. If there's more than one at the moment, it's just Grampians Health Ballarat, and go continue. And this is the benefit, right? It's pulling all the information directly from the patient file where it can, and it's has required fields so that you're not going to miss information that they require in order to accept the referral. And you can go through and put all your information in that you need to put in, whether they need an interpreter or not. But the other beautiful thing is that you can actually just attach consultation notes. If you've just taken all the information that you want to attach, you can go in and actually just choose from today's consultation notes or last week's consultation notes, whatever it might, and attach those. But a lot of the information is pulled directly from the file. You can decide to remove certain information just off the referral for whatever reason. It's going to pull all that patient information in, all of your information in, and then you can submit. I'm not going to submit. You can park it and come back to it later if you need to, but you can submit directly from there. And what happens when you do submit is it will automatically save in correspondence out. It will automatically go in there so you can keep an eye on it. All right. That is how easy it is. It obviously takes getting used to anything new, but that is certainly, I would say, the preferred way to send referrals if you can. It's going to be safe, it's going to be tracked, it's going to be secure. You're going to have all the right information in there, and it's directly from the patient file. I don't think anything is going to come up for me, but you can also, the practice manager or your receptionist are probably already doing this, where they're going to check any messages. Is it this one? No. E-referrals. So because this is a test database, there's nothing there, but usually it would have a list of all the e-referrals being sent by your practice, what the status of it is, how it was sent, and they can keep an eye on it there as well. So that's e-referrals. It's super exciting. We actually have a couple of HealthLink people in the room here. So when I do ask for questions, you're very welcome to ask. If you've got a technical question about HealthLink itself, we do have some experts in the room here with us. I'm just going to keep sharing my screen. Whip through. So I'll share these slides as I mentioned. How can you get support? There's some great videos on the HealthLink website, again, specific to your software, where you can watch how to do different things. And they also have a support desk, a phone number and an email address there that HealthLink users can use to get technical support. If you just want to have a conversation or learn a bit more about how to use it, you are very welcome to reach out to us, the digital health team at Westvic PHN, and certainly if you've got specific questions about the Grampians e-referral system, if you come to us, we can redirect that straight to Grampians Health, and we've got a few contacts there. Now, before I go to questions, I am actually going to ask everyone to take a minute, pull out your phone, or if you're on a computer, click the link in the chat. But I'm actually going to give you a second now to please go and complete that evaluation survey. I am going to mention that we currently have a digital health self-assessment tool open to all general practices and allied health. Each practice can complete it once, and they get a personalised digital health action plan from us that has suggested training and different activities. It also helps us target our education. It makes sure that you have your say on what Westvic PHN does moving forward to support digital health. So it removes the need for us to make assumptions about what general practices need and what GPs need and practice managers. As mentioned, it'll guide our future education, our support, and our strategies, and make sure that our future planned activities directly meet the needs that you identify by filling that out. So it usually goes to the practice manager or the practice owner. If you're not sure, reach out to us, the digital health team. We can check for you. It's an email that will come from a program called Kaleidoscope. I've put it on the screen there. Hopefully everyone's had a chance to fill out that evaluation survey for us. And without further ado, I'm actually going to open up the floor if we've got any questions for any of our three topics.
Okay, Sarah, can you see in the chat the questions there? Would you like me to read them out?
Yes, I haven't kept an eye on the chat.
Okay. Is that the patient can log into their own MyGov account and then reactivate their My Health record, or do we as practitioners need to do that?
No, it absolutely is the patient themselves because it's a personally controlled system. If the patient has chosen to opt out, the patient needs to go into MyGov and set that up. Now, I'm not saying you can't help them or your receptionist can't help them or your practice nurse can't help them. I'm not going to lie. I sat down with my own parents and made them do it and sat there with them and set it up for them to get access to the app. But yes, it is the patient who will need to opt in if they've opted out previously. Any other looks like there's just a good comment there about faster access. Let's have a look. Lead to patient seeing results before ordering. Doctor may be able to review. This can lead to anxiety and problems. I have heard this feedback from a couple of people before. What I would suggest is actually talking to your patient about it. And the guidance nationally around that faster access is if you're going to tick the box, do not upload to My Health record, which you absolutely have the freedom to do, it comes up on the form. When you write a pathology request or a radiology request, there is actually a box that you can tick that says do not upload to My Health record. If you think the patient's going to be anxious about it, one, talk to them about it and say, look, I'm going to tick, are you happy if I tick this box? And document that in your progress notes so that it's really clear that it was a clinical decision, it was a patient safety decision to not upload that information so that the patient isn't going to experience that anxiety. And there'll be certain patients, I completely understand that that's going to be the case. Thanks so much, HealthLink friends.
Thanks everyone for attending, and we'll see you at our next webinar. Thanks, Sarah. Bye.
Thanks very much. Bye.